Good afternoon, everyone, and welcome to the Baldrige Foundation's Institute for Performance Excellence webinar, From Planning to Doing, a framework to drive excellence. As a reminder, due to the high number of participants today, everybody will be kept on mute during the presentations. If you have questions, please submit them to the moderator in the Q&A box located on your control screen. Presenters will answer questions during our panel discussion. Before we get started today, I want to take a moment and recognize members of the Mac Baldrige Society who serve as trustees of the Foundation's Institute for Performance Excellence. It is their generous support that makes presentations like today's possible. And here's today's agenda. Our guest presenters from The Ohio State University are Dr. Dennis Delisle, Executive Director, University Hospital, Brain and Spine Hospital, and Richard M. Ross, Heart Hospital at OSU Wexner Medical Center, and Michael Martin, Associate Executive Director, Richard M. Ross Heart Hospital and Heart and Vascular Center, OSU Medical Center. After their presentation, we will take some questions from the audience, and then we'll have a few closing remarks. So now I'm going to turn it over to Dennis to get us started.
Well, thank you, Al, and thank you for the Baldrige Foundation and hosting us today. We're really excited to be here to talk about the approach that we take from planning to doing. And we think it's really important as we have these conversations and share in our journey, the tools, the concepts, the ways that we think about how we drive improvement in our work. And though we work in healthcare, hopefully what you'll find is the tools, the concepts, regardless of industry, should be applicable. So we're going to talk briefly about who we are at the Ohio State Wexner Medical Center. And again, part of what we want to talk through in this journey is the way that we thought about strategic goal cascade and some tools like the key driver diagrams that we use and feel are really compelling and impactful to take thoughts, ideas, strategic direction, and translate into tactical action. So we're based in Central Ohio in Columbus. We're one of the largest academic health systems in the country, 7 hospitals that support a wide variety of patient populations. And we have 7 health science colleges as well under the umbrella of the university. We're continuing to grow. The Columbus market is one of the fastest growing markets in the country. And as we're thinking about the work we're doing, we think about the future, the investments we need to make, the culture we need to have to support that work, and then the way in which we translate those two. Where are we going? Who do we have? What is the aspects of competency, of culture that we need to be successful over time? And I think importantly as well, as we think about this growing market that we're in, we made some very significant strategic investments, including what is the largest project in the history of the university, a $2 billion, 820-bed inpatient tower, which represents an expansion for the university hospital, where we're going to be moving many of our services into this building, as well as continuing to operate and expand the current facilities that we oversee. This work has been ongoing for just about 7 years, and in 1 year, in 400 days, we're going to be opening this facility. And that has really become a beacon for us as one of the major mile markers of the culture transformation and the operational transformation and the journey that we've been on. And I think importantly to note, when you open a facility like this, or if you have a large investment and you spend a lot of time, energy, effort into making something come to life, that really becomes the next chapter in the story, the next part of the journey that we're on. It's not the destination, but for us, it has been a true beacon for us to look towards, to say when those doors open, our expectation, our hopes is that we have arrived before the doors open in terms of culture, quality, excellence, service delivery. And it's been a really wonderful opportunity as well for us to engage the hearts, the minds of the thousands of people that we work with and have the opportunity and the privilege to serve in terms of our community and our patients. So I think that's an important piece of context as we talk through planning to doing, because this very much lives in the day-to-day, the meetings we've had, this morning, the meetings we have this afternoon and next day and next week and for the next several months. We have been planning and doing as we move forward. And I hope you get to learn some key insights of the journey that we have. And I think I always like to note, this is from our experience of the things that have worked well, and certainly the things where we're not getting it quite right, and we're continuing to learn, because what we'll share might look clean and nice, but the reality is this is hard work. We have things that work really well that we're very proud of, and we have areas of opportunity that we're going to continue to focus on and improve as we look at what matters for us, what matters for the patients in the community we serve. So I'm going to hand over to Mike, who's going to talk about the underlying leadership philosophy and the journey that we've been on. Mike?
Yeah, thank you so much, Dennis. And I'd just echo Dennis's thanks to Al and the Baldrige Foundation. We're certainly honored to be here and share more of our journey towards, achieving excellence. And as Dennis mentioned, as we talk about moving from planning to doing, it's important that we start with really our fundamental leadership vision. And this iteration of our leadership team in our University Hospital, Ross Hart Hospital, our associated operating pavilions and service lines under that leadership umbrella. This iteration has been around for about 4.5 years. It's kind of shocking to know that it's been 4.5 years. We've been through a lot in our 4.5 years, but one of the first phrases that we really aligned around, and it was honestly introduced, I think, by Dennis as he joined our organization, was that we want to be the best at getting better. We want to be known as a team that achieves excellence in what we do and how we do it. And really foundational to this, we're going to look at really 3 foundational components to becoming the best at getting better. One, investing in our people. I would call that certainly our relationship values. Establishing a team-based culture, one that's collaborative, one that's focused on performance excellence, continuous improvement, and really build on that foundation of relationship with each other at the individual and at the team level. And then beyond that, those relationship values, those leadership culture and competencies, beginning to introduce core competencies and develop core competencies in continuous improvement and improvement methodologies. And I think it's important, we're going to focus a lot on structure, process, and some of those tools that we use. But it's important to know that we've invested a significant amount of time in being deliberate and intentional in investing in our people, our culture, building an environment of trust, and really performing all that we do on that foundation of working together and viewing ourselves as a team that's all, for lack of a better phrase, swimming in the same direction, rowing in the same direction. We've had the privilege of actually speaking about our performance improvement journey on 2 other occasions here on behalf of the foundation in this webinar series. And we spent a pretty significant amount of time focusing on that relationship culture, that team of teams culture, and our leadership investment, our people development. And we like to think of this in some ways, I think of it like a 1,000-piece puzzle, essentially. I think we're all aware a large organization like our university and then our medical center is made up of multiple different clinical teams, operating teams, financial units, business units. It can be very, very complex. It's just a large, complex operating system. And then when you think of healthcare in general, that adds an entirely additional set of complexities onto what we do as a business. And then each individual patient, each patient population brings their own complexities to add to the mix as well. And so when we kind of started this journey, it's sort of like, dropping this 1,000-piece puzzle sort of all over the floor, and you kind of don't know where to start. So we started really with the concepts that we spoke about in the 2 times we were here previously. First, just getting everybody in a room together, sometimes literally getting as many leaders as we could into a room together and aligning everybody around a common purpose, a common vision, a common why, and centering everybody around that. So I liken that to the picture in the bottom left there of starting to get the right puzzle pieces sort of in the room, aligned, connecting like teams, like individuals together. And then once we've done that, we start introducing structure, process, tools, and methodologies to really start building the puzzle. And we're on our way, obviously, and hopefully to a final picture that looks much better than maybe when we started. Another way to put this is obviously focusing on our purpose first. And so we spent certainly a disproportionate amount of time focusing on who we are, why we're here, where are we going in the first at least 2 years of our journey. And we continually cycle back to why are we here, where are we going, really aligning around a purpose and making sure that everybody understood where we as an organization and where we as a leadership team hope to go to and what we hope to achieve. And we've given opportunities for people along the way to make formal and informal commitments to that purpose and make sure that we're all understanding, aligned, and committed to that purpose. Then we start to design, again, the structure and processes that really enable us to achieve those purposes and to actually get to the destination we want to get to. And then beginning to develop people through training, through the introduction of what we might call manager or performance management toolkits and skill sets in order to help us achieve our goals as well. So along with that, we've really established a framework by which we deliver our work, by which we organize our operating model that we call our team performance and execution model. Most of what we do from a meeting structure, from a team or unit structure, can really be bucketed into two categories. Team performance, which is heavily focused on how we enhance and enable our relationships, how we shape our culture, how we connect with each other, both personally and professionally, and how we connect with our organization's why. And then execution, how we use and implement tools, methodologies in a very standardized and systematic approach to really enhance, improve our practices, make the work that we do, not only the care that we deliver, but those processes that lie within and around and behind that care, make it more effective and more efficient. Briefly on our structure before I hand it back over to Dennis in just a moment, we've then attempted, again, thinking of those puzzle pieces, which are certainly sort of strewn across the area. It's almost in some ways like reverse entropy. We're kind of going from disorder and sort of reactivity, and you'll hear this theme presented, throughout our time today, to more order and structure. And so what we've done is tried to rely on what we've referred to as a team of teams model, aligning ourselves in different ways that allow us to more effectively communicate, more effectively deliver the work. So for instance, overseeing hospitals, if you think of those like an operating pavilion that's made up of multiple clinical teams or operational teams, support teams, et cetera, we've aligned in what we call a triad and dyad model. At the senior level, triads typically being a physician leader, senior physician leader, a senior nurse leader, and a senior administrator, who are responsible for aggregating, aligning, and monitoring a body of work. And then a dyad level, closer to the unit, closer to the frontline work, typically a physician leader and a nurse leader or related clinical leader that's really responsible for the local work. We have those organized typically in like services, like operative services or procedural areas, or like levels of care, critical care versus general, medical surgical care, et cetera. So we really deliver, again, communication, organization, goal setting through that triad dyad model. We've also established oversight councils, which is really a series of forums, venues, communication mechanisms that allow us to prioritize and monitor ongoing work aimed at again, improving both the efficiency and effectiveness of the work we do. So you can see a number of different councils, either related to the areas that we oversee or a body of work, for instance, patient flow, how a patient travels through our inpatient care settings and to the next level of care, for instance. We have councils then made up of leaders that's heavily focused on team performance, that relationship building, trust building, leadership competencies, succession planning, what kind of culture is necessary in order to, again, build that foundation through which work can be delivered. And then woven through that, which is, again, an added complexity in a healthcare system, is the concept of service line. If you think of a hospital operating pavilion, sort of like a point in time in which care is delivered, as complex as that may be, a service line more thinks about a patient's journey through the continuum of healthcare. So how do we align service line work, which is, a big body of the work that I do, with the important work that's done at the operating unit level, which is a big body of the work that Dennis does. And so we have a variety of communication mechanisms and forums that allow us to align that work as well.
I think it's important, as you hear Mike talk through that team of teams, to not necessarily understand, especially if you're not in healthcare, what all of that means, but maybe to appreciate the complexity and the matrix relationships of the different ways we might look at the work we do, and importantly, the people that we engage as part of the team. We like to think of this less as who you report through in the HR system and more about the people and teams that you work with in order to accomplish the job. So how do you get all of these different bodies, these groups, these individuals aligned? When we think about strategy cascade, part of the how is focused on the way in which we can align ourselves. As Mike described, what is that end destination? What is the objective or purpose that we're trying to accomplish? Because if we're using that map as the analogy, if we're driving east towards Boston, we know that if we're on the highway and there's a detour that we might meander off the highway, but we know we still have to travel east. But absent a direction or a destination, if there is a detour, it doesn't really matter if we go north, south, west, because there's no direction, so we're aimless. So first, it's really being clear about what are the priorities, what are the objectives that matter for us? And second, when we think of action, what are the things that we need to do, the tasks, the actions that we need to take that enable us to get to the direction or the destination that we desire? And lastly, when we think about accountability, what are the ways in which we strategically leverage our human resources? Accountability is not a negative connotation, it's a spectrum. How do we develop our talent? How do we harness the potential of individuals and teams? What are the ways in which we give people the tools, the resources, the training to execute the actions to help us achieve our goals? So we like this framing of action, alignment, action, and accountability because it simplifies, starting with what are we trying to do? And then as a result, it makes our decisions a bit easier for how we then think about the direction and priorities of the different teams that we work with. You might be familiar with strategy deployment or Hosch and Conry, and the intent here is to just give you another way of saying the same thing, which is when we first think about long-term objectives, how do we define what success looks like, whatever the time interval might be, the next 3, 5, 10 years? What are the key metrics that we use as an organization to define success? For us, job number one is always about quality and patient safety. We always have financial targets as well, so we can ensure that we have the ability to reinvest in our teams, people, and infrastructure. But being clear about what are those mile markers? What are the things we aspire to become? And how do we define what that looks like? That then enables us to think about from an annual perspective, as you think about your budgeting cycle, how far can we get in the next year? If we have a 3-year goal, we might have incremental progress in the first 2 years, and then we're planning for a stepwise improvement in year 3. But having an understanding of the arc of progress over time. Then we start to think about how are we going to get there? What are the actions, the investments, the resource decisions that we need to make that are going to give us the confidence that we're going to be able to move the needle. We're going to be able to affect the change that we're hoping to see. And how much of an improvement do we expect? So really getting more granular to understand if we do this, then as a result, I'm expecting to see this level of improvement. How are we making sure that there's a connection point between what I do and what I then expect to see as a result? And then lastly, who are the people, the teams, what are the resources and the competencies that are needed if we want to improve our outcomes in that time frame that we outlined? So you can see through this stepwise approach, you start with what is that vision, as Mike described. When we know the purpose, when we understand aspirationally, what are the things that matter to us, and we begin to distill that into what are the things that we can accomplish in this year? How do we make sure we're defining those priorities and aligning our teams? Importantly, when you think of how we do strategy cascade and how do we connect our staff to the why. We find it so important that there's a cascade both in the execution of work, but there's also a translation. What are the organizational goals? And then what does that mean for me as an individual contributor? I might be a bedside clinician, and I know that every day I show up is an opportunity to do great work. It's an opportunity to contribute my part to the organization's longer term goals. Importantly, if we fail to make that transition, that translation clear of what matters to the organization, what is the vision of what we aspire? What's the mission of why are we here? Why do we exist as an organization? If we can't connect our why to our people, we might be focused on compliance to the task versus commitment to the journey. So importantly, we leverage different tools that help us with beginning to codify and articulate what are the things that each team can do? What are the tasks and responsibilities that each individual can commit to? That if we do this every shift, every day, over the course of each week and each month, that is how progress is realized over time. And when we think about how do you get the right things done, part of this is also understanding as an organization, what are the levers? We always focus on outcomes, the ways in which we evaluate our success. It might be your financials, your customer satisfaction, your productivity. But in order for those outcomes which matter to move in a direction that you prefer, you have to focus on the processes, the lead measures, the things that you can take action on that are in your control. And if you have that relationship right, if we improve our processes and have good process discipline, the outcomes are a byproduct. And as Mike talked about, the journey we've been on, we've invested a lot of effort and energy in building an organizational trust factor, starting with our leaders and cascading down, because we believe that trust becomes the fluid for the important work to get done. Because when you build trust across teams, that's when you can really tackle what are those big levers and those key priorities that if we do this right, we're going to have a disproportionate impact on the organization, on the results that matter. I think it's also important to note, you can only do so many things. We have scorecards with a lot of metrics. There's a lot of things that we look at that matter. But when it comes down to it, there's only so much time, energy, resources, dollars that you have. So what that means is you have to be thoughtful and deliberate about where are you going to expend those resources. And it's not always what isn't working that you need to fix. Sometimes the question might be, what is working really well that if we made it exceptional, that differentiation becomes our competitive advantage. Sometimes you have to think about if we do nothing and assume everything is going to be constant, is there one or two things, whether it's an underperforming area or metric, or if it's a strength of ours, what is that one thing that is the disproportionate lever for us? It's also important to understand as teams, and as Mike mentioned, we have 3 hospitals within a 7-hospital system. So we have to think about how do we align to the broader organization? How do we make sure that we're not competing or conflicting our goals where we're diverging from what we're trying to accomplish as a whole? We want to make sure that we think of what is the system perspective, what is the system priority, and how do we make sure that we contribute our part? We might also be competing with the same resources. Commonly, that's something like your IT group. They're going to be asked by a lot of different teams for help, for resources, for work to get done. How does that compare when we're thinking about where we need to invest our effort? How along that journey are we going to get there when we put these factors together? So simply when we think about what is the impact, is it going to be a high impact or low? Is it going to be something easy or difficult to do? It's a simple way to begin having the right conversations to say, what are the right things that we really need to get our arms wrapped around, and then determine what are the priorities, what are the investments, and that enables you to then begin creating some commitment. I'm going to hand to Mike, who's going to start talking through some of the specific ways in which this becomes real for us.
Yeah, thanks, Dennis. And you know, as Dennis said, now how do we translate that into impactful work done at the front lines that works towards achieving both the unit level and then all the way up to the enterprise goals? And I'd like to, you know, share a principle and then maybe an analogy before we do that. You know, I think one of our underlying principles, and to reiterate some of what Dennis just shared, is that when we think about our enterprise, our organization, the Ohio State University, and then by, you know, translation, the Ohio State University Wexner Medical Center, we want every one of our 28,000 employees, 28,000 plus employees at the medical center to understand our organization's mission, vision, ambition, and values, the why of our organization, and to be able to articulate that, align with it, and hopefully align their own personal why with the organization why. So that is key. We also want every operating unit down to, again, the local level to understand what the enterprise's strategic priorities are, the things we value and measure at the enterprise level, our annual operating goals as well, and how their department or unit can contribute to each one of those goals. And further, when we think about every individual, to put it very fundamentally, we hope that every individual understands in a very simplified way the top 2, 3, 4 things that their job requires that would help us contribute to that. So the core of why am I paid to be here? Why am I here, principally, from a purpose standpoint? And why am I paid to do this particular job? And how does that align with our organization? So we use a couple different, many different actually, but we'll share at least one with you today, performance tools and performance improvement tools to help really align and make that very clear. But I think I'd be remiss to, you know, we've made it 27 minutes here, and we're the Ohio State University, and we have our beloved Buckeyes playing in the national championship here next week. And so I think I'd be remiss if I didn't use a football analogy. I'm actually a sports medicine physical therapist by background. I've been around football my whole life. I've worked with athletes, including football players, my whole life. But I just began coaching football as well for my son's 8th grade team. And I don't know how much I fully appreciated how important it is for every play, all 11 players on the field, to do their job in order for just one play to be successful. And all of those plays added up to make for a successful outcome. All of those outcomes added up to make for a successful season. So if you think about it, a team as it's planning, our Buckeyes start, you know, long before the season starts, looking at their season, saying, what is our team? What are our strengths and weaknesses? What are we going to lean into? Who are the opponents that we're playing through the year? What kind of team are we going to have to develop in order to, you know, successfully navigate that season beyond just the Big Ten and into the national championship? And then you set a game plan. This particular team, what is the game plan that we actually have to have? Then you devise a playbook, obviously, and within an individual play, you take it from the play that's called. You think about the offensive line, that particular position group has their own play card that says, if this play is called, these are the things that we need to do collectively as a unit. And then each individual offensive lineman says, this is exactly how I need to block. This is the scheme that I need to actually block towards to make this play successful. And beyond that, this is even the technique that I need to demonstrate in order or to employ in order for this scheme to work, in order for the play to work, etc. And it was kind of lost on me until I started coaching how important it is for that. And I think when you think about an organization, it's the same thing. That level of strategic forethought about an entire, you know, block of time down to the individual. What am I doing in this moment of time to work towards success? And so that's what we've tried to do. We've tried to simplify it then to get us all swimming in the same direction, essentially, as I mentioned earlier, into what are those top few things you have to do at your unit level and individual level in order to help us achieve our success. One way we've done that is through the use very frequently over the last couple years of key driver diagrams, also known frequently as aims and drivers models, One thing that I think is unique in healthcare, and I think I've read quite a few articles recently, and I think we've even talked about it organizationally, we've sort of been on a 5+ year journey of crisis mode and reaction in healthcare, whether it's pandemics, supply chain issues, natural disasters, geopolitical instability, things that really affect the way, I'm sure, not just in healthcare, but multiple organizations run. And so it's very frequent for us to be sort of in this reactive mode, trying to react to the topic of the moment, whether it's an external, pressure or some type of internal pressure placed. And what we've wanted to do is to be able to move out of that reactivity and into this alignment where we have clearly defined operational goals, clearly measurable operational and strategic goals, and then those goals cascaded and action plans to achieve or address or successfully be successful at those goals, those cascaded throughout the organization. So basic, I'm sure many people on this call are familiar. I'll just walk through an example in just a few moments here of how we do it in the healthcare industry and how we do it here at Ohio State. But the basic sense, if you're not familiar of a key driver diagram, is to start with your global aim. What is the big problem? And again, we try to simplify this for our teams, our leaders. What are the big problems you're addressing? Or what is the primary aim that you are trying to achieve? If you see an organizational goal, what are you trying to achieve in support of that? What are then those key things, those problems that cause bigger problems, or those key drivers or contributors to us that will help us achieve that aim? And then what are some of those change ideas, some of those projects, initiatives, or activities that we can really introduce and implement that will allow us to address those key drivers, which will then allow us to have successful progress towards our global aims? And we've tried to do this down again, all the way down to the frontline level, wherever possible in our hospitals. So I'm going again, the content, as Dennis mentioned earlier, is not necessarily what we're trying to get at here, but simply how we simplify and cascade very complex work. So in our university hospital and Ross Hart Hospital, we essentially focus primarily on 4 strategic themes: talent and culture, our world-class care, which is our quality and safety and the way we deliver care in a patient-centered way, operational excellence, and as Dennis mentioned, we sort of have this parallel theme going of being ready to go live and to activate our new tower, which is an entire book of business in and of itself. Putting that much more simply, and we love talking about it in this way. If you look at our talent and culture and our world-class care goals, we simply call those our taking care of people goals or our taking care of people metrics. And then the operational excellence, our financial performance, our efficiency, we call that our taking care of business metrics. So we've tried to simplify that for people, focus heavily, going back with our themes of relationship, culture, and trust, saying if we get taking care of people right, then we're going to be able to take care of business well. So we've tried to focus on those broad themes, create very general aims at the top of the business unit level first, and those key drivers towards helping us be successful in meeting those goals. So an example is our world-class care, our quality and safety goals. And again, just briefly here, we first start in our organization with a quality plan, a quality and safety plan that's endorsed by our board. That's cascaded then down to enterprise and hospital scorecards, which focus on key priorities within our quality plan. And then we cascade that down to the department, unit, or team-specific quality and safety plans. So an example here is used with our nursing team. If we focus on world-class care and we say, how do we deliver world-class care to every patient every time? 2 primary drivers that we focus on is our patient experience, our patient satisfaction, and then falls, just an example of a safety driver there, making sure that we protect patients from further injury when they're in a hospital. This is a widely accepted metric in the healthcare industry in an inpatient setting. How do we reduce falls and falls with injury in healthcare? You can see there, then we deliver secondary drivers and the metrics we'll measure those by, and some examples of key initiatives or change ideas at the nursing level: patient experience work groups, fall risk assessment tools, etc. That start to kind of dig into how are we going to address at the nursing unit level in this scenario falls with injury, patient satisfaction, and thereby our goals in world-class care. So an example of what we do, we further drive that down then in these key initiatives to templates that really further kind of tease out the work on exactly what we're going to do to address that. So in this case, specific initiatives or change ideas aimed at improving the patient experience down to not only our global nursing level, but an individual nursing unit. And another example falls with injury. We then use templates to really monitor the work, to document our current state, our goal with this particular work, our action plan, our accomplishments. Typically, we do kind of a past 90 days, upcoming 90 days, accomplishments and plans. And then if I draw you back to the structure that I spoke about earlier in this conversation, we then employ, several different councils and forums by which we either plan the work or monitor the work, report out on the work, so that it's again connected back to the broader body of work that this particular individual unit is completing, and how does it connect back with the rest, so that we're all, as we keep saying, swimming in the same direction, at least directionally appropriate. Even though we all have our own individual priorities and work, we're all aligned very closely back to the enterprise.
When we think about becoming the best at getting better, the point here is everybody is trying to improve. To differentiate amongst the competition, it's the rate of improvement that makes the difference. And in the journey that we've been on, what we found is, as we've invested in culture, as we focused on creating and distilling a strategy cascade that is simplified, so people can understand what is the point, what are we trying to align against, and therefore, what does that mean for me, whether it's nursing, housekeeping, supply chain, the operating room. We have a lot of different types of teams and service lines. So how do we make it easy enough to connect the dots between what matters for all of us and then what I'm accountable for within my group? And what we found over time, and using our experience with the Ross Hart Hospital, a variety of different results. And as Mike has mentioned, we've been on this journey for about 4.5 years at this point. We look at things like turnover, our patient experience, our employee engagement, our patient acuity, mortality, our length of stay efficiency, and then a measure that we look at as a benchmark against other academic medical centers. We've had encouraging results to see over time, and in many of these areas, you'll see there's been some significant progress over time. And we attribute a lot of that to our ability with our teams to understand not just their own responsibility, but as Mike used that analogy with the offensive lineman, the center needs to appreciate and understand what the right guard and the left guard are doing, as well as understanding what is the play? Is it a run? Is it a pass? And when you have that situational awareness, and you can understand not just what is the role that I have, but also appreciate the role and responsibility of others, you start to have much better coordination and communication, which ultimately leads to better results. What we'd like to leave you with in terms of some of our lessons learned is it starts with structure and process. When you're deliberate and intentional about how you organize and what you focus on, results are the byproduct. And that really requires leadership, and not just leaders to engage, but also the development of your leaders to have the competencies and the vocabulary to engage in conversation, to deal with conflict, to tackle the problems that actually matter. Having an operating model, or the way in which you organize the team of team structure, whatever that means in the context of your business or the industry that you're in. Leveraging data as a way to track the things that matter, the processes in which we manage, and as we affect change, making sure we understand when we do something different, are we seeing the outcome we expected? If yes, let's keep going. If no, what didn't we understand about the change that's leading to an outcome or a result that we didn't expect? Ultimately, the point is you got to keep it simple enough that people can begin to connect and resonate with what are the things that matter. That enables you to stay focused. The less you try to do, the more you will actually accomplish. And lastly, have fun. There's a lot of small wins and signals that you're moving in the right direction. And certainly there's always going to be issues and challenges that have to be addressed. But we think positive reinforcement also is a way to deposit the social goodwill that's needed to give people the energy day to day, the reinforcement that the things we're doing, the changes that are being made, or the transformation journey that we're on is amounting to something that's far greater than what any one individual can accomplish, but rather what the team as a whole can achieve. So with that, we're going to end here, and we can pause for questions from the group, and go Bucks.
Fantastic. Well, Dennis and Mike, thank you for such a great presentation. And there are a number of questions from our audience. So I'm just going to jump right in here. The first one is, how do you align efforts of diverse teams, departments, when their functional role might vary greatly, i.e. nursing versus housekeeping?
That's excellent. And part of when we think of this cascade and how we use the key driver, part of it is to provide a degree of freedom for the leaders of those areas to define, as an expert in environmental services, as an expert in critical care nursing, here are the ways we think about infection prevention. So for housekeeping, using that as an example, our environmental services team, there are things that we look at in terms of the response time for when a room is vacated, a patient leaves, that room, the specific things they need to do in order to clean and sterilize that room in order to reduce the likelihood of infection. There's things that nursing will do in terms of if you have an IV and a line place, the things we have to do to maintain sterility in the area for the patient. So there's different ways when you think about how we contribute to the work that happens. It takes a village to care for people. It takes a village within the hospital, and each role matters. So it's really one of the ways we think about this is there's a translation that needs to happen across the different disciplines and the different departments, because it is different, and that is tricky. What we found is what makes it easier is let's simplify what matters and also provide the opportunity for those teams to define how do they contribute to those goals. And then we can also challenge if we don't feel like that's necessarily as aligned as it needs to be, or it's the right lever. But that's one of the ways that we've approached that. Mike, I don't know if you would add anything different.
Yeah, Dennis, I think it's well said. The only thing otherwise that I would add, and again, it's probably in some of our past presentations more heavily than in today's, is the importance of trust and culture. I don't think we can understate that. So I completely agree with what Dennis shared there, and taking the example of infection prevention. It's easy using that example when you might have, for instance, a high infection rate in a particular area. If you don't have the relationship, trust, the common connection points, and the formal intentional connection points to throw anecdote on the wall and say it's X's fault. And then what happens is we create anecdote and we don't really solve problems. And so what we've also tried to do with our operating model, our meeting structures, our communication structures, is to be very intentional of getting those teams in a room together so that we're focused on relationship. We have rounding and shadowing with each other, so that then we say we collectively have an infection problem. How do we solve that together? And so that culture is, again, Dennis called it the fluid. That trust is the fluid of the organization. I think that's the filter through which our improvement is delivered, and then being able to cascade and align what is your role, particularly in infection prevention, is the next step.
Okay, great. The next question is, what are some of the challenges you experience when trying to align individual goals with organizational objectives?
Many. Do you want to take this, Mike?
Yeah, it's a great question. I think probably the same with any organization, and I would say probably the same with any high-performing organization. I'm always struck going back to my previous career of working with athletes. You're working with some of the best in the world, and so we're in a high performing organization, and you're working with individuals who bring their own body of work, their own goals. to the table as well. And so it's important. And I think, this is, again, maybe unrelated to today's conversation, but very critical as you think about your hiring processes as well, to make sure that you're identifying in the recruitment and hiring process people whose why aligns with the organization's why. Because I think, we talk about that often. When you're all aligned on the why, you can stomach the what and the how. I think that's a Nietzsche quote, actually, that we've shared in other forums. But part of that is obviously getting connected, everybody heading towards that same purpose. The challenges then is, each individual operating unit does have its own priorities, its own goals, its own research interests, its own business interests. And so I think that's always, the difficult, kind of the messy part of work is aligning some of those. But I think we've attempted to address that through culture, through spending time together, through really aligning on those goals, to understanding each other's priorities and goals. And frankly, you start out by probably assuming that they're very different, but as you spend more time together, you compare them, you put them on paper together, you align those to the organization's goals, you find out that there's much more similarities than there are differences. And I think you can get past to it, but it's not easy work. It's why this is, we're in year 4.5 of our improvement journey, and why we still have improvement, to go. Dennis, anything to add there?
Yeah, I would just say, even as we speak, we're planning on making changes to the way in which we drive accountability and the cascade of the tactical things that need to happen at that process level to then drive some of those outcomes. And I think that's just a reflection. When we talk about journey, we really mean that, because you have wins and then you have lessons. There are things that happen that are not what you anticipated, maybe not at the level at which you would prefer. And it requires this deliberate and intentional approach to not just set a plan and then hope it works, but rather engage with the teams, engage with staff to understand what is connecting down to the front line. Where are we missing on things we thought might have been clear, or the right connection points with teams? And we find that sometimes it works really well. And in the model we built, it has helped a lot with swimming in the same direction, but it hasn't solved some of the problems of how do we then integrate and partner in different ways to achieve different kinds of levels of performance. So even as we talk today and share a lot of the successes we've had, we're also dealing with a lot of challenges that persist, because it's a complex environment. And as even for the first question, it's a diversity of teams and a diversity of people. And that human factor is also complicated in terms of the dynamics of how you translate communication and messages, and how they're then received and then acted upon.
Fantastic. The next question we have is, how do you measure the success of your leadership philosophy in terms of both short-term and long-term outcomes?
That's a great question. And I think if I go back to, as Mike described, we like to say it's, if we take care of our people and we get that right, we'll manage the business. We can take care of that business well. And when we think of taking care of people, we've talked about culture. There's ways we measure culture. We have engagement surveys, pulse surveys. There's ways for us to get an understanding, both directly and anonymously, feedback of what's working well and what isn't. And then from a clinical and quality perspective, that's job number one. Our responsibility in healthcare is to improve lives. And there's different ways we measure that in terms of quality indicators, safety events. And then from a business perspective, part of it is growth. It's creating the access points, so making sure that we're accessible to people who need care wherever they need it. In addition to the way in which we manage our resources, the stewardship of the financials and resources that we have, so we can make the right investments. So that's the best way to describe, especially for those not familiar with healthcare, but at least with those types of terms. And what we think about short and longer term is really about, for us, we just put together a 10-year plan as an organization of the things that we hope to accomplish and the metrics at which we would then define what success looks like. And then for us directly, it becomes, here are the goals we have in our next fiscal year. And here are the goals and aspirational endeavors that we have leading into the next 2 to 5 years as well. So those are different ways that we think about, the short term versus the long term. And then certainly we'll get as granular as, here are the things that need to happen in the next week or the next month when we're talking about performance and opportunities. So it does oscillate between the very micro granular type processes to some of those broader, harder to move long-term outcomes.
That is a fantastic answer. That really aligns with the Baldrige framework as well. Next question is, how do you solicit feedback from leaders and teams to modify and improve your strategy deployment approach?
Yeah, great, Dennis. I'll take that. Another great question, and feel free to add. I think there's a number of different ways that you can answer that, but I would say that we do try to have an ongoing and iterative feedback and bi-directional feedback mechanism, both to some degree, to a good amount, obviously on where are we going, what are the goals, and tactics that we need to employ in order to achieve that, but also really, again, the framework by which we're performing or delivering the work. So for instance, I'm sure, you might have a reaction as you're listening to this when we talk about our various councils, our communication, our one-on-one meetings, our group meetings. You can lend itself to being quite meeting heavy if you're not careful. And I think that's probably true of a lot of organizations. It feels like every time we turn around, we might have another series of meetings. And so we do frequent formal and informal surveys of our teams, asking about the value of their time, the value of specific meetings and our meeting structure collectively in terms of achieving our goals, how we can best work together to accomplish our goals if we're missing anything, if we have redundancies in our work, if there are gaps in projects, initiatives, communication mechanisms that are not allowing us to achieve that. And then we have very frequent what I would call like interval engagement surveys. Both how is your individual engagement as a leader or an employee, but also how do you feel about the engagement of the team collectively, the relationships of the team collectively. And that allows us to measure the success of our work, particularly again around those foundational concepts of culture and trust. Dennis, anything to add?
I think the only other thing I would add is we even do simple things like in meeting surveys, everybody takes out their phone and we might have a prompt. So you can anonymously provide feedback on a topic, but then you see the results come live, and that helps us then have an opportunity to discuss concerns, what's working well, where do we need to provide clarity. And that helps us also, we like to use the expression of authorship promotes ownership. When we can ask for feedback, incorporate that feedback and demonstrate to people, we asked, you answered, we made this change. As a result, have you seen an improvement? And that last question is the most important, because then that demonstrates it's not just our idea, it's not just my idea, but it is our collective. And that changes from compliance to commitment. And what we find is when we do these sorts of, and sometimes they're funny questions, the rating scale is not always a 1 is not performing and 5 is excellent. We do, we're as slow as an elephant or as fast as a cheetah. There's different ways of engaging and getting input, but the point is to then drive the right conversation. What do we need to talk about? What aren't we talking about that matters? Because it's in having those conversations that the real work can get done. So we find that we do a lot of different ways of pulse checking with our teams in different forums, different venues, different tools, because we find that without getting that iterative feedback, we're going to move into compliance mode and it becomes rote. And it just becomes this another meeting, another thing, and not the best use of my time, and therefore not where I spend my energy. So we find that that is essential to keep the lifeblood of the work that we're doing in the culture moving forward.
Fantastic. We've got time for one more question, so I'm gonna grab this one here. It's a little in depth. Great presentation, thank you. You talked about meeting as groups to create alignment. did you also find that you had to have a number of one-on-one conversations and dialogues to manage each stakeholder's individual alignment and needs? And if so, can you talk a bit about the process you used related to that?
Yeah, I mean, certainly. And as Mike said, it can be meeting heavy, and especially with roles like ours, it can be quite intense. Um, Absolutely. Part of building relationships and rapport is at the one-on-one level before you can then have it at the group level. And we even do something we call the appreciative inquiry, which is at our leadership level, it's about 65 leaders or so. We randomly assign every other month a one-on-one assignment that each of us gets. And the intention in that one-on-one is to get to know about the person. Where are you from? Why'd you get into healthcare? What do you do outside of work that fills your cup? Are you play an instrument? You have children? Do you like to travel? Do you go hiking? Let's find some commonality, because what we found is when you get to know who people are rather than just the job that they have, you start to find the connections of Mike's a musician, so am I. Well, we built a relationship that really started exploring things about music that had nothing to do with work, but all of a sudden we realized there's a friendship within the partnership. And we've seen that so many times over. And I think importantly as well, the one-on-ones are an opportunity for people to share their hopes, the fears, concerns, for us to help with reinforcing the right messages and to create the safe space for people to connect. So it is a one-on-one to a one-to-many in terms of the types of ways in which we engage our teams. Mike, anything you'd want to add as well?
Yeah, just maybe one or two things, Dennis. I think, I would start by saying, relationships are built on authenticity. And so it's difficult to manufacture, relationship. And so I think Dennis put it very well there, that through this appreciative inquiry and other things, really getting to know the person in an authentic and more personal way. But we have tried to create specific avenues for people also to evaluate the nature of their relationships. So for instance, we do have some formal relationship inventory mechanisms where we ask people, who are the other leaders or teams that you partner with closely, not very closely? Who do you need that you rely upon for success? And do sort of, what I might refer to as a fearless self-inventory. What is the nature of that relationship? And not asking people, hey, do you get along or not? But what is the depth of the relationship? Do you understand each other's work? And then those areas where maybe I rely on this person heavily as a leader and as a team to be successful in my work. But frankly, if I'm inventorying, we probably don't have a very strong or close relationship. Then create intentional mechanisms for you actually to develop that relationship. And so we do have some formal ways that we attempt, without again trying to manufacture an inauthentic, structure, but ways that just allow an individual to be guided through an inventory to say, do I have the strategic relationships I need in order for me to contribute, one, to the success of my team, and two, to the success of the organization?
Fantastic answer. Fantastic. Hey guys, Mike, Dennis, again, thank you so much for another outstanding presentation. We truly appreciate your taking the time to spend with us today and our audience, and I look forward to doing it again with you.
Thank you, Al. Thank you for the opportunity and for the Baldrige Foundation, and go Bucks.
Yeah, thank you all very much.
Fantastic. Okay, everybody, as a reminder, the Foundations Institute has more than 400 professional development and certification opportunities offered online and at your own pace. And this month, we are showcasing 3 courses directly relating to today's presentation: a healthcare yellow belt course, a healthcare green belt course, and a healthcare project management course, specifically designed for the healthcare industry. You can visit the Institute website at baldrigeinstitute.org/education to learn more and to register. As a reminder, the recorded version of today's presentation and the slides will be available on the Foundation's website early next week. And once again, thanks to all of our great sponsors and donors. We hope to see you all again next month when our monthly webinar on February the 27th will have guest presenter George Taylor from Beyond Feedback. Thanks again for attending today's webinar, everybody, and have a great day.